In this video essay, I'm going to look at the work of art therapists in community groups. According to the 5-year forward view for mental health, 3/4 of people with mental health problems are not receiving support at all. Several current sources reflect the consequences of the lack of adequate mental health support, like the tragic case of Sarah Green, who committed suicide after being taken away from home into an adolescent ward. Other articles underline the fact that the NHS has no means of preventing mental health problems in people who are at risk of becoming more ill. What part can art therapy play in this situation? This video essay will explore 3 main points. Is art therapy still a public service offered by the NHS? Are there other organizations providing art therapy to people with mental health problems? And how can art therapists working with groups in the community support people with mental health problems that the NHS cannot support? As a background to the issue explored here, a few words on the history of art therapy in the UK are relevant. Art therapy first developed in the late 1940s and 1950s. This was initially through lone pioneer figures from art backgrounds who set up studio spaces within the large psychiatric hospitals. By the 1980s, the profession had become more established and art therapist was an official profession in the NHS. At the same time, a new way of helping people with mental health problems was established. Many long-stay institutions were closed and people were placed in the community. This change, although positive in many ways, like living with a greater sense of autonomy and becoming more culturally and socially integrated, could be seen as an opportunity for the government to save money on the cost of running large hospitals and to move towards a policy of outsourcing care to the private and voluntary sectors. However, Plant writes in 2006 that this process was not accompanied by the support, expertise and money needed to maximize such a scenario. The experience of Chris Peckham, whom I interviewed, illustrates this process. He has worked for the NHS since 1989 and is currently also working as an art therapist for the charity Resources for Autism. Now in 2017, we are experiencing a new changing landscape. As you can read in BATS magazine news briefing, the theme for this year's annual general meeting is Innovating Practice, Meeting the Needs of Changing Landscape and Reflecting on Art Therapy's Move Away from the Statutory Sector into Charities, the Voluntary Sector and the Growth of Self-Employment. Comparing the survey that BAT did in 1990 with the report Workforce Risk and Opportunities for Art Therapists written in 2012, there are now 20% fewer art therapists working for the NHS. A survey of 85 art therapists qualified between 2012 and 2014 showed that 75% were able to find a job, but it took a lot longer than in previous years for art therapists qualified in 2014 to find jobs. Nearly 63% have several part-time posts, which again shows how art therapists have to be proactive, flexible and resourceful, which aligns with point 14.4 of the HCPC. Be able to change the practice as needed to take account of new developments or changing context. I went to interview Bobby Lloyd, CEO and art therapist of Art Refuge UK and co-lead artist director of the Drawing Shed, both being charities. With this changing landscape and crisis in the NHS, Bobby Lloyd emphasised that
the NHS is the biggest employer, I think, still of art therapists. So there are art therapists all over every hospital and every service, even though a lot of the services have been cut. But then there's lots of cuts across all services.
I asked Chris Peckham about his circumstances within the NHS.
There's always, been cutbacks and generally, and things to contend with. But I think the last few years, I've sensed the pressure in the teams. There's just an expectation for more with less resources, and people really a lot of stress and really struggling, and just and often just the situations you're dealing with that people present in their lives. I think there's the impact of the recession. You just see it in people's lives and what people are dealing with, and at the same time you're trying to support those people with what feels often like more stretched resources.
In February, a long-awaited NHS task force reported that England's mental health services have been chronically underfunded. The Minister says he wants that to change.
We're trying to increase the amount both of community provision and specialised care. We now have 1,400 acute beds available for children and young people. That's the most we've ever had. We've added 50 since I became the Minister. At the same time, we have an investment of £1.4 billion into children's and young people's services.
The 5-year forward view, 2014, says that Some of what is needed can be brought about by the NHS itself. Other actions require new partnership with local communities, local authorities and employers. The investment by charities is minor if you compare with the government service. However, these voluntary organizations often have an impact well beyond what statutory services alone can achieve. Scriven and Orm, 1996, discuss a number of dilemmas concerning the voluntary sector, which are still unresolved in 2017. Voluntary organizations have normally been established as a direct outcome of the expressed needs of their clients, but their freedom comes with a penalty, that they are frequently constrained by funding pressures. A factor that is mentioned in the NHS 5-year forward view 2014 is the interest in future involving new partnership with patients and communities. Multiple research shows the benefits of art therapy working with groups within the community. For example, Slayton in 2012 explains that one way to facilitate social change is to utilize the group as a social microcosm. The group mirrors community experiences many clients have lacked. Plan 2006, in the article Promoting Group Cohesion through Art Therapy, explains that community projects could play an important role offering needed services, but mostly helping the individuals become less socially isolated. The benefits of working with art therapy in groups in the community have been laid out. Liebman 2004 discusses some disadvantages of therapy for groups, including lack of confidentiality and less individual attention. In addition, when depending on charity and government funding, these projects have a fragile structure. An example of a service funded by the NHS is the work that Chris Peckham does for the North East London Foundation Trust. Chris facilitated an art therapy open studio where people with mental health and learning disabilities work as a group.
So there are people mainly we work with individually, and thought maybe they've come to the end of the individual work, but it would be good for them to work, to still have some support, and also maybe build relationships with other more peer support to sort of sustain them within and help them to be less isolated. So we've been running this group now in the community, and it very much is also about people's identity as artists as well. So giving people helping them to kind of keep that going beyond their individual therapy is something that empowers them in terms of their well-being.
The current NHS investment in mental health is limited, so art therapists have to find other alternatives, working in private practice with local authorities or the voluntary sector to be able to deliver a service. A successful example of art therapy in private practice is Chroma Therapies. Chroma works in private and NHS settings, with local authorities across the UK receiving extra funding from foundations for certain projects. Joe Gothel, the clinical service manager, has been shortlisted for an award, Advancing Healthcare Awards. Another successful example of a project partially funded by the government through the local authority appears in these awards. Emma Mills has been shortlisted for an award for her work.
Hello, I'm Emma Mills and I'm a Mental Wellbeing Coordinator for Southend Borough Council and Metal Arts Organisation. Our aim is to take small groups of members of the community who are living with low-level mental health problems and to give them access to digital art-making facilities.
The report of the Allied Health Professions into Action 2017, developed by the NHS, demonstrates the relevance of innovation within art therapy, and the impact this pilot project, working in partnership with a museum, has had on a group of people with mental health problems and learning disabilities at risk of isolation. Bobby Lloyd gives an example of how schools can contribute to her work within the community.
One of the main things is that a child and adolescent mental health service, people think that that's where the highest need children are given a service. But the moment you stop working for a service like that, you realise that the vast majority of children who need a service don't reach it. And so I started to work in schools and discovered that some of the most hard to reach children and young people could be given a service within the school setting, which is just part of the fabric of their everyday life.
To conclude with an example of voluntary sector organisation, Art Refuge UK charity, which work with refugees and whose CEO is Bobby Lloyd.
So I've been working for at least 2 decades in contexts of conflict, and on and off in all sorts of different places across the world. And I'm often asked the question, what are you doing bringing art when basic needs aren't necessarily being met? And I always would say that art is actually an essential resource. It's one of the protective factors that human beings look to at times of crisis, along with dreaming, family, spirituality, all the things that we draw on as human beings.
To summarize and conclude, here again are the main points of this video essay. Art therapy service within the NHS has been reduced, but as the allied health profession into action shows, there are innovative examples to prove that art therapy still offers substantial support with NHS funding to people with mental health problems. Apart from the NHS, there are local authorities working in partnership, private practitioners and voluntary sector organisations providing art therapy to ensure a wider range of people benefit from art therapy. Within the changing landscape, there are many combinations of funding and partnership which enable creative, innovative and resourceful art therapies to respond to demands for art therapy services in the community.